How many times in the last few weeks have you wished for a coronavirus vaccine? As we isolate and count down the days till scientists save us from COVID-19, there couldn't be a greater reminder of the power of vaccines. But people still have questions about their safety and how they work. So I spoke to Professor Julie Lisk, who's a public health expert at the University of Sydney and knows a whole lot about vaccines. And I asked her, when will the coronavirus vaccine be ready?
I'm hoping that there will be a vaccine available against COVID-19 by the end of next year, 2021, but nobody knows for sure. There are no guarantees here. Scientists around the world are working hard right now to develop a vaccine. They're using these really innovative approaches to vaccine development based partly on what was learnt from previous SARS and Ebola responses. And if it's successful, this will be the fastest vaccine development and validation process in history.
So it looks like we will be waiting for a while for the COVID-19 vaccine. But what should parents do in the meantime? Should children still get their routine vaccines, even in the middle of this global pandemic?
Some families might be worrying right now about taking their child to the clinics for vaccination or for regular checkups. It's really important to keep getting your child's usual vaccines. Vaccines prevent other serious diseases, so it's important that children and babies keep their vaccinations up to date and stay healthy. You might also find that COVID-19 is temporarily changing the way vaccination services are offered. If you're not sure whether your immunisation service is running, just check with your healthcare provider. If you can't get to a clinic when your child's next vaccinations are due for some reason, make a note somewhere to try to remind yourself once that service resumes again.
Okay, now what about parents with newborns? How can they protect their babies from coronavirus?
The good news is that most newborns only have mild symptoms or no symptoms of COVID-19 at all. You might have heard some media reports of young children being infected or even dying from it. But based on the available evidence that we have now, newborn babies are not at particularly increased risk of getting infected or of dying from COVID-19. But of course, we still want to minimise risk of COVID-19 or any infectious disease in our babies. So stick to the advice about hand washing, about physical distancing and maintaining those hygiene practices. It is safe for mothers to breastfeed their babies because the virus doesn't get into breast milk. Breastfeeding protects babies from viruses and from other infections. If a mother has COVID-19, her baby needs the protection that breastfeeding gives. If you have COVID-19, you should always wear a mask when you are with your baby, including when you are feeding them, and wash your hands before you handle your baby and after touching your own face and coughing or sneezing. And also wipe down the countertops and the diaper changing stations with disinfectant wipes regularly. Or if you don't have that, just warm soapy water and then drying it well.
And finally, what can we learn from this outbreak? What's the big takeaway for you?
I think for me, this outbreak reminds me of just how valuable vaccines are. That without the protection of vaccines, diseases like COVID-19 can spread really quickly and with serious consequences. It's a reminder that when there's a vaccine available for a disease, we should keep getting our children and ourselves vaccinated. And we're so fortunate to have the protection of vaccines against some of these diseases.
So don't wait, vaccinate whenever you get the chance. We hope you found this helpful. Let us know in the comment section below. Stay safe. And remember, vaccines work.